So today we'll be discussing about the pectoral region. Now pectoral region is the anterior part of the thorax. So over here we can see this is the skin. What we can see is certain surface landmarks. So you are having, this is the nipple region. Then this is the areola. If we talk about the bony landmarks, we are having the subcutaneous clavicle bone over here. Then there is a notch that is known as the jugular notch, which is above the manubrium. Then if we go downwards, we will be having a transverse wrist-like structure that is known as the sternal angular fluid, which will be corresponding to the second rib. And this is how the rib counting will happen. Now let's reflect the skin. So first you will be having the superficial fascia in which the mammary gland is situated, and this is the lean and thin cadaver. So you can see there is a very minimal amount of superficial fascia which has been removed along with the skin, and then we will be encountering the deep fascia. Now this deep fascia is the pectoral fascia, which is bounding up the pectoralis major muscle, and this pectoralis major muscle is a fan-shaped muscle. It is having its medial attachments from the medial 1/3 of the anterior surface of the clavicle. This is the clavicular head. Then you are having the sternocostal head. This sternocostal head arises from the anterior surface of the sternum, and then the costochondral junctions of the upper 5 to 6 ribs. And then there is an aponeurotic attachment. If you can see, this is the external oblique aponeurosis muscle. And over here, this is the aponeurotic attachment, and this muscle has been detached from this aponeurotic attachment. So this is the aponeurotic attachment. Now this is a fan-shaped muscle which will be getting inserted into the bicipital groove by means of two lamina, the anterior lamina and the posterior lamina. So let's see how it looks on a bone. So now let's discuss about the pectoralis major attachments on the bones. So this is the clavicle. On the medial 1/3 of the anterior surface of the clavicle, you will be having the clavicular head. Then this is the anterior surface of the sternum, which will be having its attachments on the pectoralis major muscle, and then you are having the costochondral junctions of the upper 5 to 6 ribs. These are also having the attachments of the pectoralis major muscle. If we talk about its insertion, it will be getting inserted. So see, it is a fan-shaped like muscle, and it will be getting inserted into such a small area that is known as the bicipital groove. So automatically it has to twist, and it gets twisted to form two laminas, that is the anterior lamina, which will be comprising the clavicular head, and the posterior lamina, which will be comprising the sternocostal part. And these will be twisting, and the twisting will happen so that the inferior fibers will be located superior most, and the upper fibers will be located inferior most. Now when we reflect the pectoralis major, what we encounter is a fascia that is known as the clavipectoral fascia. Now this clavipectoral fascia encloses two muscles. A muscle which is situated between the first rib and the clavicle, that is the subclavius muscle, which is a very small muscle. Then you are having the clavipectoral fascia which are fused together, and they again split out to enclose another muscle, that is the pectoralis minor muscle. So in between the junction of these two enclosures of the subclavius muscle and the pectoralis minor muscle, you are having the piercing of various structures. So over here we can see, this is the cephalic vein. This is the cephalic vein, the bluish one. It pierces the clavipectoral fascia. Then there is the lateral pectoral nerve, which will be supplying the pectoralis major as well as the pectoralis minor muscle. This is again piercing the clavipectoral fascia. Then you are having the thoracoacromial artery. Now this thoracoacromial artery is the second part of the axillary artery, and it sends out two articular branches and two muscular branches. What we can see is a muscular branch of the pectoralis major muscle, and this is known as the pectoral branch of the thoracoacromial artery. Rest will be discussed further. So it will be having two articular branches to the clavicle and to the acromion, and another muscular branch that is to the deltoid muscle. Now coming to the pectoralis minor muscle, it is a triangular muscle which gains its origin from the 3rd, 4th and 5th ribs, that is 3rd, 4th and 5th ribs, on the outer surface of the costochondral junction. So these are getting attached over the outer surface of the costochondral junction on the outer surface of the ribs, and they will be getting inserted to a prominent point that is known as the coracoid process. Now this pectoralis minor muscle is a very important muscle in the demarcation of the axillary artery, because the axillary artery beneath it will be getting divided into first part, which is above it, second over here, and third beneath it. Now let's talk about the bony attachments of the pectoralis minor. So the bony attachments of the pectoralis minor is from the outer surface of the third, fourth and fifth ribs near the costochondral junction, and they will be getting attached over the medial surface of the coracoid process. Now beneath this pectoralis minor muscle, we will be having a serrated muscle that is known as the serratus anterior muscle. Now the serratus anterior muscle is having altogether 8 digitations, which will be arising from the medial border of the scapula and then will be attaching to the outer surface of the ribs. So let's see their bony attachments. Bony attachments of the serratus anterior. So it will be taking its attachment on the outer surface of the first 8 ribs. So the first digitation will be situated between the first and second ribs. Rest will be to the corresponding ribs. And if we talk about the insertion, so this is the scapula of the right side, and this is the lateral border, and this is the medial border. So the first and second digitation will be getting attached to the superior angle. The third and the fourth will be getting attached to the medial border on the ventral aspect. And then you are having rest 8 digitations which are getting attached to the inferior scapula. So the muscles will be getting arising from here and will be getting inserted like this.